Okay, welcome back, everybody, to Recharging the Human Battery Radio. I'm sitting here with my co-host, Mandi Dickey, who's kind of taken the helm here for a couple weeks. We are on AM 950 radio, and we're going to recharge your human battery today. So we've got something a little bit. We're going to do something a little bit different today. So yesterday, we're a couple days ago, we'll say, I was on the panel of the Minneapolis-St. Paul Business Journal Health Forum with other really great panelists, a hospital CEO, health plan CEO, another CEO of a business that basically manages health plans for businesses, and then the CEO of the Minnesota Hospital Administration. It was very interesting discussion. So many points came out of it. There were so many questions, and basically what the gist of this meeting is to get together diverse healthcare leaders in one room to discuss what is most important to our fellow Minnesotans, businesses, because mostly business, other business leaders were in attendance, thinking about how to get their population more healthy, but also to the general population. So there were people that do nonprofit work. There were nursing schools there. It was a very diverse audience, and they had put it this way: after the discussion, there were so many questions. Hands were up. I don't know what they were going to ask, but one of the things is that in a forum like that, it really needs to be, 4 or 5 hours, honestly. And I think people would have been really dialed in and wanting more, so I think the best way to do this, and myself and Mandi, we talk healthcare all the time. We talk things. She has no idea what I'm going to ask her, which is going to make this episode really fun. But it's all questions she knows the answers to. It would be really easy. What do you think? And this isn't even one of the questions, but what do you think, your personal thing, what do you think going into the next couple of years is the biggest challenge that patients are going to find kind of navigating the healthcare system? Before we even get into this, we'll take up the questions on the other side.
Yeah, the biggest thing that comes to mind is cost. Insurance plans have changed over the last few years. My husband's changed for our family, and just trying to navigate the cost of healthcare is insane. And when you're paying $500 for a routine appointment at your ortho appointment, and you could have gone somewhere else and gotten maybe potentially more answers, people don't know about the other options. So I think it's going to be learning about what those other options are and trying to find where they want to spend their money.
No, absolutely. And we've talked about this extensively. It's about, it's really about investing into your own self. I actually did a keynote talk last week to salesmen and women at a aesthetic company. It was their big national sales meeting. And one of the talking points was, because I'm trying to get them to how do they basically get into the physician's mind, which is we can talk about that for hours, but it's we have issues and we're very selective with what we want. But one of the ways to get it is, for example, when they're trying to sell their aesthetics products, one of them is for fat reduction. And the kind of the theory behind it is people will spend their money on things that make them feel better, to look better. However, the way to really, get that into the hands of a physician, why do I care about that? Why would I care about that as a doc? Because the more people are having these positive mental, ideas about themselves and are feeling better, the more likely they are to, follow their normal regimen, take their medications as prescribed, do their diet, exercise. So every little thing chips away. So I just tried to do that. But back on that, that's people spending their own money for, and in this case, it was this Venus Bliss Max. It was this product. It's really amazing. Like the results of it are really mind blowing. It's just, how do you convince people to spend those dollars to help them? And it's great for those GLP-1 patients, something like that. So we'll pick this up on the other side of the break. I think this is going to be a great episode. Don't go anywhere. We're on Recharging the Human Battery Radio. I'm Dr. Sinicropi. I'm with Mandi Dickey, and she's going to be on the hot seat here on the other side of the break. Okay, we are back on Recharging the Human Battery Radio on AM 950, and today we are going to talk about a subject that is really important, and that is how can we help you guys to get better healthcare, to navigate the system better, and also businesses, any business leaders that are listening to this, or if you are in HR or whatever, what's coming down the pipeline in 2025. And these are the issues we discussed at the conference with the Minneapolis St. Paul Business Journal, a diverse group of CEOs from the healthcare industry. Now, I'll know, here's an interesting little factoid, and this is our climate and our environment. We could start with this because we've had an entire episode about this. But interestingly, there were two insurance company CEOs slated to speak at this event, but because of the current climate, they both backed out of the event because of fear of security and safety issues. And interestingly, they actually had the check-in booth on a different floor yesterday, and with beefed up security just in case, you could imagine that when they kind of prep me and saying, hey, we really want you to answer this question or that question. One of the questions they said that was really my question that they were going to throw at me was acknowledging why people had such a frustration towards the healthcare system and the very horrible assassination of the United Health CEO. So you could imagine, I'm thinking to myself, man, maybe I need some beefed up security, even though I'm with you. I'm fighting with you. We're together in this. We have the same gripes, but certainly, going to violence. So we could just start with that. What was really brought, I think the gist of the answers to the question when we were talking about the anger towards the healthcare system, because I know we've done this ad nauseum on another show, but one of the things was, all the panelists generally were shocked at how celebrated the assassinator was. And I even said, yes, when I was doing the thing, I said, well, listen, I'm not even going to say his name because he doesn't deserve naming. And when you start naming these people, that's what makes them even more infamous and whatever. Were you shocked? We'll start with that. Were you shocked? Because honestly, on social media, people were rooting for the guy. They were saying, this is great. Somebody, I think it was on either Colbert, one of those shows, they mentioned the guy, and people the people were like a long ovation for this horrible.
I was not shocked, honestly. The United Health has had such a bad reputation for a long time for not getting covered. And I've had friends who've worked for the company and lost their positions, and they thought that they had job security, and the company did not have that security for them. So it did not surprise me that people celebrated it because of just the reputation of the organization, unfortunately.
Yeah, I mean, what surprised me is not, listen, we've had this discussion. My patients come in so angry. I have multiple patients every single day, and they're literally making an appointment because they've been denied for some care. Sometimes it's not even surgery. It could be an MRI. It could be anything. And they're just there to vent their frustrations. They're making an appointment with me for nothing else than somehow either I'm going to magically fix it. They're mad at me. They're mad at my staff. I can't believe this is our healthcare system, blah, blah, blah. So we can talk about that all day, but there is a lot of anger out there. But the question is, and this is what was nice about doing a forum like that. I understand there's a lot of anger and we need massive insurance reform. But if we're not having conversations like that, nothing's going to change. And it's going to take business leaders to say, I'm not going to do this anymore. What was interesting though, was that Minnesota, from a business perspective, is a state that is on almost the top of the list for businesses actually getting the best plans for their citizens, which was good, which was nice to see. I didn't know that the Minnesota, there were health plans up there, and then the Minnesota Hospital Association, president was up there, who, by the way, is very, very, very funny guy. He was great on the panel, but I think that at least in our state, generally people that have good jobs do have access to more than they do in a lot of other states. And that's something that, because again, that's my concern is what is going on in this state. I don't really look at, all the other states and start comparing it, because, my passion is really getting our patients the care that they need. But is that surprising? Do you feel like, is that surprising to you?
It does a little bit.
It's a little...
I know that we have great healthcare. I didn't know that we had great healthcare coverage for that purpose.
I didn't know that, because you would think by the amount of complaints that, that come through the office, that like people's coverage, is awful. What we didn't get into, unfortunately, which I really want, is the holes in the coverage, because again, you might have the quote unquote Cadillac plan, but that Cadillac plan might not cover all these great things that we have for you. And I did bring a little bit of but again, it wasn't a forum where, I could speak for 45 minutes and just get all these points out. I just, had to kind of, conform to what they were talking about. But it was really, really interesting. Now, one thing that is that came out of that I brought up was a poll that was done in Time Magazine, as a Harris poll. It was released in 2023. 70% of people are not happy with their coverage, over like with what they're covered for. And it's interesting. What do you think is the number one complaint about the healthcare system? I mean, covered by the healthcare system, not by insurances, but what's the number one gripe with our current healthcare system? What do you think it is? I mean, there's many, and they're not that far in disparity, but there was one that was overall like the biggest thing.
Like medications versus appointments, or
it's something about like I'll just throw it out, because it's not because there's a lot, but the number one thing is wait times for appointments, getting in with a provider. So for example, I just had I had a friend that needed a dermatology appointment, and they're like upset with me. I'm like, what? Nothing to do with me. I'm sorry. I don't represent the whole healthcare system, but we're just saying one dermatologist, 3 months. It was a 3-month wait. The average wait for a specialist, which I think is underdone, is supposedly 24 days in some studies. It's probably higher than that for spine specialty, way higher than that for neurology and some of these other specialties. And certainly there's a lot of out-of-pocket places, there's a lot of concierge places people can go to. And I think that that's good. And, we're involved in some of those things, but that was number one. But, it's interesting. And I was happy to see that, was the lowest thing on their, like on the top, like of the top things. There were things that weren't high, was provider communication. So maybe we're getting better, maybe we're getting better. And it was still a 20% of people, like that was their top concern. So obviously we got to pull some people along, for the ride, but that was an interest. But 70% of people are just not happy in general with what's available for them. So those numbers aren't good. So I just wanted to kind of, throw that out there. So here was one of my favorite things. Here's another question. Why are the wait times, and I'll tell you how I answer it. Why are the wait times in the emergency room, why do they suck in American healthcare? They do. I mean, honestly, what's your general consensus of why there's people in gurneys in the hall? Now I get it. You're like, oh my God, you're flashing me back to the COVID days. A lot of that stuff is back. So I'll tell you kind of what the panel was focusing on. Then I'll tell you what I focused on, which is a completely different perspective. What do you think is the biggest? Well, like what's your, like if somebody your friend of yours calls you from the ER, it's a 6-hour wait, and you just want to kind of give them an explanation, go.
Yeah. My top two things. One is because it takes so long to get into your provider. So the wait times are so long. If you have an illness now and you call to set up an appointment and they say, well, they can see you in 2 months. Well, you're sick now. So that's a problem. And number two, insurance covers the ER it tends to cover the ER better than it does your other appointments. So if you go to the ER, I had an ER appointment or ER visit last summer, spent 4 days in the hospital. That was cheaper than my follow-up appointments in the clinic. So doing that it's insane how well that was covered versus anything else that I do. But people can afford to do that. So when they can go and they can go quickly and they can get that care done, it's those are my top two.
Yeah, and that was great, and things like that kind of came out. One of the things that kind of the hospital folks wanted to really focus on was the fact they can't get people out of the beds in the hospital. So they were giving like these crazy things like, oh, like some people have been there like 200 plus days in the hospital with either a mental health thing or whatever. And then it's that downstream where you can't get them into nursing homes. And again, I was getting flashbacks of COVID because it was a complete disaster with the nursing homes, who you could send. And yes, you could send them with COVID. No, you can't. And it's crazy. I don't want to rehash that because I don't have the fortitude, and I didn't do enough red light to kind of counter that. That effect. But what the point that I wanted to make, it's great. And the things you said, absolutely, that those are big things. But let's think even bigger. Let's think even long term, because we're in the health and wellness space. How about the fact that so many of those visits to the ERs are because of exacerbation of chronic disease, which is not appropriately managed? And we are not doing a good job. How many of those patients, that when you had to, your injury, how many of those patients were there with diabetic, exacerbations, where their blood sugars are 700 and they're sick out of their minds, or people that have hypertensive crisis because either they weren't following the regimen, they're on the wrong regimen, no one's ever found the root cause of their hypertension, so they're being treated inappropriately. Let's not even talk about like the fact that we don't have enough psych providers, and so these ERs are filled with. I remember doing, my ER stuff, and the most fascinating thing was just sitting down talking to people about how there's satellites in their coffee grains. And I'm thinking to myself, like, how is this the right place to take care of these people? Like, they need high level care. Either they have to be whatever, they're coming off the streets, all kinds of stuff is going on. So the people that are coming off the streets, obviously they're not going to access a lot of healthcare, but all these other people with autoimmune disease, major exacerbations. Why? Because they're not being managed appropriately, because our care system is so fragmented. People don't have care navigators. They're not doing all the things we talk about on it. They let their diets go. What about inflammatory bowel disease? Okay, people, and a lot of them, they do get a higher level of care, so they know exactly what foods they can and cannot eat. But you know what? It's Thanksgiving, it's this, it's that. My aunt is here and she traveled from North Dakota, so we're just going to live it up. And then they're in there with these huge exacerbations. And so these ERs are just filled with all this chronic disease. Yes, the other stuff is absolutely true. But again, not getting appointments, it fits into that, where you can't get the appointment in there. And then you can't see your doctor. And you either are starting to panic because you're going downhill, you're deteriorating. Maybe you would have normally not gone to urgent care or the emergency room, but you're like, screw it, I'm getting sick. Like, I have diarrhea constantly because, and I have I have ulcerative colitis, and this is getting bad. And I can't get in with my doctor for 3 days, whatever it is, but it's a mess. Yeah. Would you agree that, like, if we don't get a handle on our chronic disease situation and tamp that down by preventative care, it's going to get so much worse. No, the answer, and I agree with the panelists, the answer is not building another 1,000 ERs so that we can house all these people. How about none of them go there? Because we keep them healthier. Anything to add on that?
Yeah, no, I think I mentioned like a month or so ago when we kind of talked about this topic previously, I had a podcast interview on, and he was a concierge physician who used to be an ER doctor. And he did that because everything was chronic illness coming in. So he wanted to add to the chronic illness management side of things and went into concierge medicine to try to keep those people out of the ERs. So it's a huge issue.
No, it's a huge issue, and it's interesting because at our integrative health center, we're just onboarding a family medicine concierge doctor who can take care of all people's needs. It's actually low cost. It's a monthly member, but guess what? He's available. He answers all his own things. He's available 24/7, and he'll just take care of you if you have thing. And he manages all these, and that's what it needs to be. The current system, like the waits it's ridiculous, especially it's interesting because the providers that do the best job, they're the ones that have the longest wait times. So paradoxically, they're going to be able to manage the condition the best, but you can't get to them. So how's that working? So we have a lot of issues. We'll see what these, this is totally off subject and we didn't talk about it yesterday. And I would have, if I started talking about the stuff that's in my head, we'll be there all day. All day. But it's interesting because you can now create, you can do it now. I haven't explored it. I'm going to do it. You can create an AI agent that is you. So you can go in and basically create, and I don't want to call it a digital twin because that's a little bit different. That's when we're like doing like digital twins of like buildings or whatever, or your processes, things like that. But for example, you can go, and I think this is the solution for the future. We're going to talk about this another time because AI is really fascinating. But you can train a bot to become you. And if you train it enough, and it listens to you. So if you let like all your visits, anytime you talk to it, when you do your podcast, you can feed in everything you've ever written. You can give it every video you've ever made. You can hang out with it. You can talk to it all day. Eventually, the answers that it's going to give is almost what you would give. It's amazing. And I've seen it. Like there's all these things. Like there's a program, for example, they did it with just one text. And so they did, and this is common now, but this is when I first heard of it. I was like, oh my God, I gotta research this stuff. But they did it with the Bible. And so they took the entire Bible and they put it in, and then they put in all this other information. And so you can just have conversations with people in the Bible, and it kind of simulates exactly kind of what they would say. Not exactly, but close enough. So you can have, if you want to talk to Mary for a little bit, you can just say like, what'd you think about, when this was happening? And then there'll be like all this stuff will just come out. It's crazy. So you can talk to text. So it's amazing because like some of these things, like, like the Iliad and the Odyssey, all these like books that we had to like be forced to read when we were and it's cool. I liked it. I love that stuff. I love like the mythology stuff, but all of these things are going to be put into these AI programs, and you could just have conversations with them and start like, it's just fascinating. But we could have a Mandi, Dickey digital twin, and guess what? Then you could service 20 million patients at the same time. They could just ask you, and you'll just answer, and you're not even there. That's where we're going. I just let you. I'm glad that I gave you something that you didn't know. Usually you know something about it. You're like, that one, you had me. We could talk about that on an
I feel about that.
Yeah, AI in healthcare is going to change absolutely everything. So. Okay, here's one, and I just get your take on it. You're talking about rising costs. Yeah, and this one, we didn't even get to this one because we got so dialed into some of these other things. But so I want to get to some of the things that we didn't get to. So rising costs, what can we do as providers? How can we help the payers understand how important it is, for example, for 24/7 concierge medicine, like people to really have availability to their doctor or to a doctor that can help them, not somebody who's in an emergency or they're not going to know they're hit. They're not going to know that. And how can we help them to understand that some of these preventative health measures, like all the biohacking, how can we help them understand that this is how you're going to keep you want to save money? As an insurer, well, for God's sake, get your population healthier. To me, it's the most obvious thing ever. But they're not doing it. Why? Tell me how can we make them understand?
The why is a good thing. I have no idea how to answer that question, but I don't know how better to describe it than to talk about it like you're buying a new car and you take it in for your routine maintenance. When you do that, you're less likely to have a catastrophic event with your vehicle. So somehow we need to get the payers to understand that it's the same thing with the human. You bring yourself in for your routine maintenance, you're less likely to have something else happen. Does that mean something else isn't going to happen? No, there's always going to be other things that come up, accidents, illness, whatever. That happens even regardless whether or not you are taking care of yourself 100% as you should. So some things will happen, but if you're doing that preventative maintenance, you are less likely. Individuals need to understand it. The insurance companies need to understand it. I don't know how to say it other than just plain black and white like that.
Yeah, and we know, and this is what I brought up. We know that our patients are not educated on how to stay well. That's why I'm writing a book on it, because I cannot watch this. They are not educated. So let's go a little. I'm going to go a little conspiracy. because it makes no sense.
Yeah.
So so you're telling me you're an insurer and you have all these covered lives under you, and you have these like really watered down like wellness programs. And I'm saying that because they, compared to like, for example, what we're doing in our wellness centers, it's nothing. It's a nothing burger. They like, maybe there's some recipes on there, so whatever. It's lower level stuff. But if you focused on that and you put a lot of your dollars, and they have plenty of dollars as coming out, right? That's all over the media. And you really educate those people, and they should almost be forcing people, not even saying, hey, if you do red light therapy, if you do oxygen, if you do all these other things, and you do it, and you commit to doing it 20 times a year or 50 times a year or whatever it is, we will actually reduce your because they're not going to have the same exacerbations of their chronic illness. So this is, I mean, I could like literally, if we got a senator in here, I could explain it to them in 20 minutes and they would be like, why aren't we doing that? All fired up. So I'm going to give a little, here's my conspiracy theory. Again, this is just stuff I like to just talk. What do you think about this? Because I was thinking about it after I had this thing, and I'm like, okay, I'm saying all this stuff. Now I have to think about, well, why isn't it happening? Because it makes no sense. Yeah. Is it possible that they don't want to, this is weird. Is it possible that the insurers, even though they talk about their rising costs and they want to cut down on stuff, is it possible that they're trying to like play both ends? On the one hand, they want like high level procedures, which unfortunately people need because you've let them get that sick. So you want to cut that down. So you want to delay all that stuff on that side. But on the other end, is it possible that they fear that if people do all the things we talk about on the show, that then no one's going to buy the Cadillac programs anymore, and then they're going to lose money that way? So is it possible that they just want people to buy the highest level care, spend the most money? And when I say the people, I mean the business, like the employers, and you could buy it, like individually through the markets. But employers, I could tell you at Midwest Spine and Brain, it's ridiculous what we pay for our employees. It's literally ridiculous, and it's skyrocketed over the last 10 years. It's insane. But is it just possible that they, right, by keeping people from getting better, then we have a bunch of people that have all these chronic health issues who then need the MAC, so then it's just like a vicious cycle. I'm just throwing things out there. Do you think that could be, is that a conspiracy theory, or is that maybe seeming plausible?
It is definitely plausible. So, for case in point, I was watching an episode of Grey's Anatomy yesterday. I love that show.
And that's where we get all our information from for the show. So
but
you're in good hands.
So in a moment, they were all standing outside the emergency room waiting for ambulances to come in a trauma. They were waiting because they knew somebody was going to come. And the one person said, so we're just standing here waiting, hoping that somebody gets in a tragic accident and comes and needs care. We're going to do this, and you're okay. God's okay with you doing this. It was just a really good example of how we sometimes have the best of intentions, but in doing so, we get sidetracked by the other things that look big and flashy. Like that trauma looks big and flashy, and you want to be able to take care of that, but you're hoping that somebody gets sick in order to do that. And these insurance companies are hoping that people will need that Cadillac plan so that they can continue to pay their bills, fill their pockets, whatever the case may be.
Yeah.
And I don't think they do it totally maliciously. I'd like to think that, but there is something to say about that they're not going to have that money if people don't need it.
Again, I just want to reiterate for you guys, we talk about all these things, on our show. So it all starts with nutrition and sleep and all the, like the basic stuff. But then when you add like all of the different quote unquote alternative, the dumbest word, because it's not alternative. It should be the mainstream. The other stuff, it should be alternative. SSRIs, it should be alternative. Some of the cholesterol medicines that you guys get put on, and we can do an entire show just on that and what I've seen. And again, this isn't medical advice. Please follow the advice of your doctors, and please, do your own research. But I'm just telling you this alternative stuff. But anyway, we're confident. We'll sit here and say this. I will say with complete confidence, and as a physician, whatever, if you do these quote unquote alternative things that people are out there that have so much data data behind it, you will invest, not in all things, it's not a solution for everything, but the vast majority of people will be a lot healthier, and you're going to need less care. We know this. It's done. It's a wrap. I know this. And so if we know this, and either you guys are not doing it, or you're not, it's not, obviously insurance is not covering it right now. You have to ask yourself, why is it not covering? And then you have to ask yourself, we have to get rid of this notion, because this was brought up again yesterday. It was actually by a patient. This notion of, oh, the insurance doesn't cover it. Oh, that means there's no support behind it. That's BS. That's BS, because there's so many things your insurance plan does cover that is not even safe. And then there are things that are incredible for you, and they would be so low cost to the insurance company, but yet they don't cover it. So again, do your own research, be CEOs of your own health. We could go on with this for forever. And it's just insane. So on that note, businesses. Okay, we always talk about this, and a lot of our focus is on the general population. I look at businesses, quote unquote, wellness plans, and it's laughable. It's laughable. No, having the massage person come once a week. It's great. Love massage. Love my massage therapist, by the way. Shout out to Jessica. She's awesome. But having a massage person come with the chair once a week, that's not a wellness strategy. That ain't going to help you with your lupus. I'm sorry. It's fine. You might be happier. There's a lot of questions. How do we educate the business community of how important it is for them to have robust wellness plans? And we have one, but a lot of people, we have one through our wellness clinics, and, we've had some people sign up for it, and I think they're going to do great. How do we convince them to at least sign up for something like robust? The amount of productivity, their employees feeling better, attrition, and their employees really going, less. And yeah, I understand the way that it may not save them that much as far as like their insurance plans but it certainly saved them on like work comp stuff and everything, because even improving your cellular health will improve you, especially, some of the nerve entrapment syndromes and some of these other things can be helped with these plans. And so how do we educate these businesses and how they're like really missing an amazing opportunity to make their employees better?
Mm-hmm. I think a lot of conversations need to happen on that. Side note with that, I recently went to a viewing of the documentary called The M Factor about menopause. Mm-hmm. And they talked about how businesses can help support for that particular health topic. And the company Genentech, they make the clot busting medication that helps save people's lives when they have a stroke. They had a topic group. They had a work group come in, and they talked to their employees about how can we help you better stay healthy. They actually took the lead on that and asked their employees to come and be a part of this work group. And they talked about menopause, and they talked about all these other things. And they've actually built this whole wellness protocol for women that are falling into that perimenopausal age, so that they can be better supported with their health and that they don't miss work because of it. So I think if we can encourage companies to have conversations like that with their employees, what can we do to help you? And then just present them with the information. This is how many work days are missed because of this in your employment. And this is how it can be better if you help them stay well. I think just that knowledge, most of them don't think of it. Sure, they know what they're supposed to do on a personal level, but they don't think about what they're supposed to do on a professional level. They don't think about how it affects the whole company. And if they don't personally have a health issue themselves, they don't realize how it can affect their employees.
No, absolutely. That was well said. That's spot on. I mean, a lot of times now we do, obviously, with our company, we talk about health and wellness initiatives. And actually my, Sherry, our administrator, kind of our dyad as we lead the organization, she is a health and wellness, so passionate. She is like, she's meditated for 24 hours in a row in a church, and she does all this stuff. So between the two of us, we preach health and wellness constantly. to our employees. Now, did they take advantage of it? That's a different story. Despite having all the access in the world, despite now having, a connection with our hypercharge clinic and all this other stuff, still there's people that don't take advantage of this stuff because they're too busy. They don't have time. Same thing. That's why they don't go to the gym. That's why they don't take walk, because they're too busy and they don't have time. Who doesn't have time to take a 15-minute walk? I don't know, but you must be the busiest person in the world. So I think we need to just, think about this. So that's kind of the focus on preventative care, and things like that. I think, we've got a little bit of time left, and we've talked about this before, but I think it was one of the most important things that we really discussed. There were a lot of like clinical entities there that were managing stuff. So there was like an entire nursing school, like the head of the nursing school was there, and there was a lot of different questions. So one of the questions that we talked about that came up was this notion of all of these things that we talk about with healthcare initiatives. They're great, but we can't institute them if doctors are dropping like flies and leaving the workforce, nurses are dropping like flies. So right now, the current, the kind of the latest numbers from the best surveys out there, about 53% of physicians experience burnout, 60% of nurses experience burnout. And you could put, nurse practitioners and PAs somewhere in that same bucket, including like nurse assistants, everybody else that is helping. It's just that those are like the big surveys that are out there. And, if you ask physicians, so many of them are thinking of leaving the workforce in the next, especially people that are like Gen Xers and boomers, forget it. The boomers are out of here with the electronic medical record and whatever. And so we talked about like the notion of autonomy. And that's the big, I really hit on that. I was like, it's because we're losing autonomy. That's why people are burnt out. But what I want to ask you is, and my thoughts is, how important is it for those providers to get their act in order as far as their physical health and understanding how to be CEOs of their own health? Because most of them are not. They're just not. And their mental health, even more importantly, because we're like in a big crisis. So what's your suggestions on all that? What are you seeing? What do you want to say?
Yeah. So I used to joke with my patients all the time about the golden years. When you get older and you retire and you got all this time to yourself, the golden years are only golden because you're spending all your money in the healthcare system. And if you're not taking care of yourself, your retirement is spent in the hospital. You get sick a lot. You're not keeping yourself busy. I see a lot of people after they retire, they get bored, they get depressed, because they're not doing what they used to do. They don't feel like they're contributing to society. So while, yes, they're getting burnout on the job, they're getting burnout from not doing anything once they retire. So getting that good baseline so that you have your health in order before you retire is so important, so that you're not spending your golden retirement age in the hospital. I've seen too many people do that.
Yeah, but not only that, is how many stories do you know of people that work, they're not happy, they do all this stuff, then they're like, I'm going to retire. And then you hear horror stories like, oh, they died of this.
Yeah.
They had this. And a lot of it is probably related to the fact that you're absolutely right. You took me in a different direction. I wasn't expecting you to go there. But when people don't have a mission in life, when they don't have, we always need something to keep us going. That's why when Tom Hanks is on that island, and like literally he had Wilson, right? But and it's like, you don't have anything. We're so like, you can't, like you have no, like, what are you going to do? Now he had a mission, he built a raft, he's doing stuff. So he had stuff to do. But if you're just sitting there, people are like, I just want to retire and just sit on the beach with my Mai Tai. That's not as fun as it seems. We need missions. So we can talk about a little bit more on the other side of the break, but I'm not trying to be Debbie, you guys know me, I'm Mr. Positive, but I see, this is true. Like, there are physicians that they're miserable because they're burnt out and things have changed. And I've seen them transition to retirement, and then they're sitting in the doctor's lounge just because they don't have like friends outside of the industry, and they're just there like because they want to talk to people, and it's not great. So you've got, like, we have to focus on ourselves. You got to keep your mental and your physical should be your number one priority. And that goes back to the thing we said before, but yet people don't want to spend money to invest into themselves. But man, that 73rd in-season Twins game where you're going to spend $600, and shove a couple hot dogs and some other stuff down your throat, that's worth the money. We'll see you guys on the other side of the break. We're on AM 950 radio. Coming back soon. All right, welcome back to Recharging the Human Battery Radio. I'm Dr. Sinicropi. I'm with Mandi Dickey, and we're having a fascinating discussion about how to help the healthcare system in general. And actually, Mandi, I had potentially one other question, but she took me in a different direction, because that's what we do here when you're in studio. Like, you just go where we let it go where it's going to go. This point about always trying to think about what your mission in life is. And it's interesting because in that healthcare, debate or forum that we did, a lot of that was reconnecting the providers with their mission of really helping our fellow human beings, and connecting with that really makes us feel good. That's when we feel the best. I'm sure we've talked about that. We feel great when we can help somebody and we hear these stories. That's what we did it for in the first place. When you lose connection with that, and it's all woe is me, and this sucks, and I have another 12-hour shift, and all these people are in, and the census is horrible, and this person has that, and that's not a good, but anyway, when we have mission in life, so that's when we're the most energized, when we're like, hey, we're really doing this, we're helping people, we're doing stuff. So it just brought up a couple other thoughts. And it's interesting because I was on another panel this last week with an immense health event, and that came up too, maintaining your mission. So there was an NFL player. He's only in his 30s. He retired. He's won a Super Bowl. Pretty awesome stuff. He was right next to me, and he talked about how so many of his friends that are retiring from the NFL, they feel completely lost. And so he's gone down the direction. He played golf for 3 years, he said. And then he's like, I probably should do something. And so now he's selling real estate. He loves it because he's like, I'm helping people in a different way. Mm-hmm. And I feel like I have a mission. But some people are completely lost. They don't know what to do. They're used to spending all this money. And then they realize, okay, now I don't have a mission, but I'm spending money. Eventually it runs out. And then they become depressed. Same thing with veteran syndrome, right? They come back. Some of them have been in for 10, 20 years. And then they become civilians, and they literally don't know what to do. And you need a mission. And I listen to like Jocko, who I'm sure a lot of you guys listen to, and David Goggins, and all these grformer guys that were SEALs, and they talk about that all the time. You always need another mission, even if you're 80. You need a mission, and whether that's watching your grandkids grow up or do whatever, you just need a mission, or finishing that rock collection. I was like, you guys know, when you don't have a mission, you can't do it. That's something that we certainly don't teach. And maybe we can weave that into our, making sure that people have a mission in life as part of a healthcare plan. And I do talk to people about that, in the thing, but maybe it should just be, we should talk to all our patients about making sure they have a mission, or at least asking them, well, what are you looking at in life? Because it's really important for their health.
Yeah. Yeah. And aside from that too, is just having something that makes you enjoy life. Mm-hmm. So I used to ask my patients all the time if they had hobbies, and they would kind of look at me funny. I'm like, do you have something that you do outside of work? Because when you get, like we were talking about before the break, when you get to that point when you're retiring, if you don't have anything else that you enjoy doing, there's nothing else to occupy your time. So whether it's a mission that you have to do something, or a mission that you enjoy, you need to find something that you can do outside of those work hours.
Well, I mean, this is real fascinating. And honestly, having a mission, it ties into so many other things we talk about on the show, but it can be a significant part of helping you with your chronic disease. Because when you have a mission, you're more likely to take care of your health. You're more likely to follow doctor's advice. You're more likely to seek other opinions. You're more likely to follow that nutritional plan. It's just really, really important. So have that mission. have that goal in life, do whatever you want, volunteer for your church, go. You got to do stuff, because remember, when you help people, I think I might have said it on the show before,
Yeah.
but when you help people, it's literally the most selfish thing you can do, because it helps you to release all those chemicals and hormones that are going to help heal your body. So we might have a couple more questions that we have to get going on next show, since Mandi just brought up it's so important what she brought up. It's so important that might be as important as all the other things we talked about, because honestly, if you're just like, miserable because you don't have anything to do, it's definitely going to hamper your health. Anyway, hopefully you guys enjoyed this. We'll see you on the next episode of Recharging the Human Battery here on AM 950 Radio. Dr. Sinicropi, Mandi Dickey, we are out.